Hello, this is Dr. Kim. I'm an integrative and functional medicine physician with expertise in LDN therapy. I've been prescribing LDN for probably more than 20 years, and doing that has given me some insights into LDN. Today, I would like to talk about some side effects of LDN. LDN means to me anywhere between zero point 0.1 milligram to probably 24 milligrams or 25 milligrams, and it's low dose. And I may even call 1 microgram LDN just because it's really well known. And what what I've seen is that it really depends. Like, people are always all saying, "What is my optimum dose?" And I do have a video on optimal dose, so you can look for that, or it should be. I'll put it in the description part as well. So to make long story short, there's no optimal dose for everyone. You need to figure out what your optimal dose is for yourself, and you can do that by understanding how sensitive you are to medications, how long you have had the condition, how 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 much the disease has or the condition has taken away from you. So if you're 18-year-old and you are full of energy, you can do whatever you want to do, you can stay up all night, then probably no problem starting at 4.5 milligrams. But on the other hand, if you have multiple conditions like fibromyalgia, chronic fatigue, and maybe a couple of other conditions undiscovered yet, and then I think that lower doses of naltrexone, anywhere between 1 microgram or 100 microgram, which is zero point 0.1 milligram, is very appropriate. The reason is that if your endorphin level, which there's no real affordable testing to see how much endorphin you have, and so what I have done, probably got really good at, is just talking to the patients, talking to the people, and say, "Hey, how do you sleep at night? When you get up, do you have enough energy at the end of the day? Are you pretty much done with your energy?" So from there, you can get ideas. So some of the side effects I see a lot are headaches, worsening of their symptoms, including pain. Fatigue is another one. And rare cases, they can get like cold sweats. And that's because almost like they're going through endorphin withdrawal. And you see that in opioid withdrawal. So, and these advice is for people not on opioids. For people who are taking opioids, I've done some videos, and you can look at that, or you can just start with microgram dosing. I have also another video on when do you use like a microgram dosing. The really one of the way is if you're taking opioid, because your chances of having naltrexone even at 100 microgram giving you side effect is pretty good. So we do that. Another reason I do 1 microgram is for children. I just don't like taking any chances with children, especially side effect. And part of that is that as a parent, I know that if my child suffers, I'm going to be very sensitive about that. And so I just don't allow that to happen, because it's not in the best interest of anybody. It's not in my best interest. It is not in anyone's. So if someone is already endorphin depleted, long disease process, or had it for a long time, suffering a lot, I would say 1 microgram is perfect, and they should stay there until they're ready to move it up. Uh, and that's kind of my general approach to avoid side effect. Again, the biggest side effect I've seen is headache. Another one would be fatigue, but rarely I will get patients saying my symptoms are worse, or MCAS, mast cell activation, or allergy is different, my hair is falling out. All those can be prevented if you can understand the idea of optimal dosing needs to be individualized. Going up needs to be individualized, and you need to work with somebody who has a good grasp of this. And um, I think that's like crucial. If you cannot do that, then educate yourself and find someone who will work with you. So this is Dr. Kim, and we talked about 3 common side effects, including headache, fatigue, and and diaphoresis or cold sweat. But others are possible too. Just pay attention and keep on talking to your provider, or you can come to the forum and say, hey guys, can anyone speak about this? This has been my experience. And if you have, can you just share with me? And the reason is that if you say, what should I do? The chances that your post will get flagged as a spam gets higher. I've gotten flagged and I did nothing wrong, and you guys would have done nothing wrong. But Facebook just is very severe with consequences. So thank you again. And if you've learned something, please subscribe, please share, and please like the video. I appreciate you. Thank you.